Hi guys, welcome back to Learn Nursing with Anu. If you're preparing for NCLEX-RN exam, one of the most important skills you must master is prioritization. Many NCLEX questions ask things like which patient should the nurse see first or which findings requires immediate action. So this exam is not just testing your memory, it's testing your clinical judgment, patient safety and decision making. In real nursing practice, several patients may need care at the same time, but the nurse must quickly decide who is in the most immediate danger. In this video, I am going to share 10 essential NCLEX prioritization rules that will help you break down these questions and confidently choose a correct answer. Let's start with the most important rule in nursing. That's ABC, airway, breathing and circulation. This sequence changes in CPR to CAB, that is circulation, airway and breathing, but almost in the NCLEX prioritization questions and general patient care situation, we still follow the ABC rules. Problems affecting oxygenation are always the highest priority. If a patient cannot breathe properly, nothing else matters because oxygenation is essential for survival. For example, imagine two patients. One patient is complaining of chest pain and another patient has a blocked airway and is struggling to breathe. In this situation, the patient with the airway obstruction must be treated first. In NCLEX, whenever you see airway compromise, severe respiratory distress, choking, or low level of oxygen levels, those patients usually becomes the top priority. The next rule is unstable before stable. An unstable patient shows signs that their condition is suddenly worsening. These warning signs include sudden change in vital signs or altered levels of consciousness, chest pain, new shortness of breath, or signs of shock. For example, if one patient has chronic arthritis pain and other patient becomes confused or restless, the confused patient is a priority because this could indicate hypoxia, infection, or neurological changes. In NCLEX, questions always look for sudden deterioration. Another important rule is acute before chronic. Acute problems are sudden and potentially life threatening, while chronic conditions are long term and usually more stable. For instance, a patient with newly developed internal bleeding is most urgent than a patient with long standing diabetes. A simple way to remember this is today's emergency is more important than yesterday's diagnosis. Closely related to this is the idea that new symptoms are red flags. When a patient develops a new symptoms, it may indicate that their condition is worsening. For example, if a patient suddenly develops confusion, severe headache, or sudden difficulty in breathing, this requires immediate assessment. So in NCLEX questions, the word new onset is often a clue that the patient should be prioritized. Next, we have the Maslow's hierarchy of needs, which helps nurse to prioritize physiological needs before psychological needs. Basic physical needs such as oxygenation, circulation, glucose balance, or hydration and temperature regulation must be stabilized first. For example, if one patient is experiencing shortness of breath and another patient is feeling anxious about surgery, the patient with breathing difficulty is a priority. Emotional support is important, but physiological stability always comes first. Another key rule is safety first. Nurses must always prevent immediate harm to the patient. Patients who are at risk of falls, seizures, active bleeding, or self-harm require rapid attention. For example, a confused elderly patient attempting to get out of the bed without assistance has a high risk of falling and must be addressed quickly to prevent injury. So in exams, patient safety is major theme, so always consider who is in danger right now. A helpful strategy is to ask yourself which patient could deteriorate first. In other words, which patient could crash in the few minutes if nothing is done. So patients with rapidly dropping BP, severe respiratory distress or signs of shocks require immediate interventions. In prioritization questions, the patient who is most likely to deteriorate quickly is often the correct answer. So another NCLEX concept is expected versus unexpected findings. So expected findings are normal for a certain conditions and are usually lower priority. Unexpected findings are however, may indicate a complication. For example, mild pain after surgery is expected, but low BP or excessive bleeding after surgery is unexpected and could indicate hemorrhage. So, that patients must be assessed immediately. The next rule is assessment before action. In most situations, the nurse should gather more information about the patient's condition before performing an intervention. For example, if a patient reports new pain, the nurse should assess the location, severity, the characteristics before giving medication. However, there are exceptions. If the patient has an airway obstruction or cardiac arrest, immediate action must be taken. And finally, remember the principle of least restrictive or least invasive interventions first. Nurses should begin with the simplest and the safest interventions before moving into more aggressive treatments. For example, if a patient is experiencing breathing difficulty, oxygen therapy may be started before considering advanced airway management. So similarly, repositioning a patient may be attempted before using restraints. So whenever you see a prioritization question on the NCLEX exam, pause and ask yourself 3 important questions. Is the airway safe? Who is unstable? And who could deteriorate quickly? These simple steps can guide you towards the safest clinical decision and correct answer. So remember, NCLEX prioritization is not about memorizing answers. With practice, these prioritization tools will become natural and you will start recognizing patterns in NCLEX questions much faster. Not only will this help you pass the exam, but it will also strengthen your clinical judgment in real nursing practice. Thank you for learning with me today on Learn Nursing with Anu, and if you find this video helpful, don't forget to subscribe for more NCLEX tips and nursing concepts. See you guys in the next video. Thank you.